Dr. Briant WARNING. Most people believe their medications always work, but for weak kidneys, some can be doing harm in secret. You've always heard that medications heal and protect, but the very drugs you trust may be slowly harming your kidneys without pain or warning. As we age, our kidneys weaken and become more sensitive to medications, especially when taken too often or in high doses. Common painkillers, antibiotics, and even heart or diabetes medications can overload your kidneys until they silently fail. You won't feel it right away. No pain, no signs, just a slow, silent buildup of damage. By the time swelling or fatigue sets in, the damage may already be severe. But here's the good news. Knowing which medications to be cautious with can help protect your kidneys today. In this video, I show you 7 everyday medications that could be silently harming your kidneys and the safer options you can make. This series has 2 parts, so watch until the end, because one of them might be in your house right now. Proton pump inhibitors, or PPIs, are among the most common medications people take today, often without a second thought. They're the pills many reach for to calm acid reflux or heartburn, those burning sensations that keep you awake at night. They work by blocking the enzyme in your stomach, responsible for acid production, giving fast, powerful relief. But here's the warning few people hear. While PPIs are effective, using them too often or for too long can quietly harm your kidneys. Studies now show that these drugs can trigger a condition called acute interstitial nephritis, where inflammation develops inside your kidneys, filtering structures. The scary part is, it often happens silently. You may not feel pain or see changes in your urine until the damage is already underway. Over time, this can progress from sudden kidney injury to chronic kidney disease. Another hidden risk of long-term PPI use is low magnesium, a condition called hypomagnesemia. Magnesium keeps your muscles, nerves, and heart rhythms stable, but when levels drop, it can cause spasms, fatigue, or irregular heartbeat. Worse, this imbalance can also trigger inflammation that makes kidney damage even worse. In a large 2019 study following over 90,000 adults, researchers found that PPI users had more than 4 times the risk of acute kidney injury and a higher chance of developing chronic kidney disease compared to those who didn't take them. The conclusion was clear. The longer you take these medications, the higher your risk. The truth is, PPIs were never meant to be lifelong treatments. They were designed for short-term relief while underlying causes are corrected. But because they're available over the counter, many people stay on them for years, unknowingly increasing their risk. If you need to take PPIs, use the lowest effective dose for the shortest possible time, and have your doctor check your kidney function and magnesium levels regularly. If you've been on them long-term, don't stop suddenly, but ask your doctor how to taper safely. Relief from heartburn is important, but not at the cost of your kidneys. Remember, the goal is balance. Protect your comfort without compromising your long-term health, because even the smallest pill can have the biggest impact when it comes to your kidneys. Diuretics are often called water pills, and they're commonly prescribed to reduce swelling, control high blood pressure, or manage heart and kidney failure. They work by helping your body get rid of excess salt and water through urine, which relieves pressure on your heart and blood vessels. You might know some of the common names: furosemide, known as Lasix, hydrochlorothiazide, or HCTZ, and spironolactone, found in aldactone. When used correctly, these medications can be life-saving, especially for people with hypertension or fluid buildup. But here's where most people go wrong. Because diuretics make you urinate more, taking them too often or at high doses can easily dehydrate you. And dehydration, especially in someone whose kidneys are already weak, can trigger serious damage. Diuretics don't directly harm kidney cells like painkillers do, but they change how your kidneys handle electrolytes, things like sodium, potassium, and calcium. When these levels become unbalanced, your kidneys have to work harder to keep things stable, and that extra stress can lead to acute kidney injury. A large study that followed over 130 patients found that nearly 1 in 4 cases of kidney injury were linked to diuretic use alone, especially when combined with other medications. Most of those patients already had chronic kidney disease, high blood pressure, or diabetes, all of which made them more vulnerable. The good news is, these problems are preventable. Always take diuretics exactly as prescribed, never double your dose, and keep yourself hydrated. If you have kidney disease or take these medications long-term, ask your doctor for regular kidney function and electrolyte tests. You can even do simple home tests today to monitor your kidney health between visits. Remember, diuretics can be your ally when used wisely, but without proper care, they can quietly become your kidney's hidden enemy. Most people don't recognize the name NSAIDs, but they know the pills all too well. Ibuprofen, aspirin, Motrin, ketorolac, celecoxib, naproxen. They're the go-to for headaches, muscle pain, arthritis, and even the common cold. More than 30 million Americans take these drugs every single day, often without realizing the hidden cost to their kidneys. Here's the truth. NSAIDs work by blocking an enzyme called COX, which helps your body produce the chemicals that cause pain and inflammation. Sounds helpful, right? But COX also protects your kidneys, keeps blood flowing properly, and helps you eliminate extra salt and water. When you block it, you interfere with your kidneys' built-in safety system. That's why long-term or high-dose use of NSAIDs can quietly cause kidney damage. For some, it begins with mild changes in blood flow. The vessels inside your kidneys narrow, fluid builds up, blood pressure rises, and you start retaining water. For others, the damage goes deeper, leading to acute tubular necrosis, where kidney cells literally die from lack of oxygen. Over time, what begins as a temporary problem can turn into chronic kidney disease. Even though NSAIDs are marketed as anti-inflammatory, using them too long can trigger the very thing they claim to prevent inflammation in the kidney's filtering tubes. It doesn't happen to everyone, but studies show that 1 to 5% of daily users experience some form of kidney injury every year. That means up to 2 million people worldwide suffer from drug-induced kidney damage, often without warning. A large study published in the Journal of the American Society of Nephrology found that taking NSAIDs increased the risk of acute kidney injury by 26%, especially within the first month of use. The good news is, if the damage is caught early, it can often be reversed by stopping the medication and switching to safer pain relief options. Another study followed patients with chronic pain who stopped taking NSAIDs after a year and saw their kidney function improve. So if you rely on painkillers regularly, talk to your doctor about alternatives like acetaminophen or non-drug pain management methods. Because while NSAIDs can ease pain today, they can silently destroy your kidneys tomorrow. And the next type of medication on our list might surprise you even more, because most people actually believe it protects their kidneys. But the truth is far more complicated. Antibiotics are some of the most commonly prescribed medications in America, but what many people don't realize is that some of them can quietly harm your kidneys. Have you ever been prescribed antibiotics for a sore throat, skin infection, or urinary tract infection? If so, you may have taken drugs like amoxicillin, Cipro, Bactrim, or Augmentin. These medicines are powerful tools against bacteria, but when misused or overused, they can become dangerous. Antibiotics work by killing bacteria or preventing them from multiplying, but they can't treat viruses like the flu, colds, or bronchitis. Yet, many people still take them for viral infections, often without realizing the risks. Your kidneys are the body's main filters, removing toxins and waste, including leftover antibiotics. When these drugs stay in your system too long or are taken in high doses, they can irritate and damage kidney cells. Some antibiotics, like aminoglycosides and vancomycin, can build up inside the kidneys and cause inflammation or even cell death. Others, like polymyxins, can harm the protective lining of kidney cells, leading to leakage and injury. Over time, this kind of stress can reduce your kidney function, sometimes without any symptoms, until the damage becomes serious. According to the CDC, nearly 1/3 of all antibiotics prescribed in the US are unnecessary. That's millions of doses taken for conditions that don't even need them, placing countless kidneys at risk for no reason. So what can you do? The answer is simple but powerful. Only take antibiotics when absolutely necessary, and always under a doctor's supervision. If your doctor prescribes one, ask, is this really needed? And follow the exact dose and schedule given. Never save leftover pills or share antibiotics with someone else, even if their symptoms sound similar. Every prescription is unique, tailored to your body, your condition, and your kidneys' ability to process it. Misusing antibiotics doesn't just weaken your immune system, it can quietly push your kidneys toward failure. Protect them by using antibiotics wisely, giving your body what it truly needs, not what it doesn't. And if this video helps you better understand your kidney health, give it a like so we can share more life-saving insights just like this one. If you found this video helpful, stay tuned for part 2, where I'll show you how to protect your kidneys from medication damage and tips to use drugs safely without risking your health. Remember, knowledge is your best protection, and even small changes can make a huge difference for your kidneys. So tell me, have you ever noticed your kidney health or energy improving after changing even one habit? Share your story below. It might inspire someone else. And if you want more practical guidance for healthier years, subscribe to Better Health Daily so we can keep learning together. Stay informed, stay healthy, and I'll see you in the next video.